All right, ready to dive into something kind of surprising today. We're tackling the link between ADHD and oral health. Now, I got to admit, when I saw all these articles and research you sent, I thought we were going to uncover some secret ADHD toothpaste formula or something. Turns out it's way more interesting than that. We're going to dig into how ADHD actually affects those daily habits that keep our smiles, well, sparkling.
Hey everyone, and yeah, it is fascinating how these things connect. We think about focus with ADHD, right? But those executive function skills,
Yeah.
huge for remembering to floss, surprisingly enough.
Okay, so let's talk about this whole executive function thing for a sec. It's one of those terms that gets thrown around, but what's it actually mean when we're talking teeth?
Yeah, good point. It can sound jargony. Basically, it's like your brain's management system. Planning, organizing, getting stuff done, all essential for a good oral hygiene routine, which, as you can imagine.
Can be tough if your brain's management system is a little, let's say, unconventional, thanks to ADHD.
Exactly.
And the research mentioned this isn't just a kid thing, right?
Mm-hmm.
It affects adults with ADHD too.
Absolutely. How it shows up can be different, though. Think about a kid with ADHD. Sitting still for 2 minutes of brushing feels like forever, especially with other exciting stuff grabbing their attention.
Makes total sense.
Plus, the dentist. Sensory overload central, bright lights, weird sounds, those pokey tool.
Right, on top of everything else.
Now with adults who have ADHD, life just gets in the way, even with the best intentions. You're running late, wrangling kids. That morning brush is easily forgotten.
Evenings aren't much better, let's be honest.
Yeah.
One thing that really got me from the research was how ADHD seems linked to more cavities, gum disease, even teeth grinding, that bruxism thing.
It's all connected. Inconsistent brushing because of those executive function hiccups, hello cavities, gum issues.
And the bruxism part, isn't stress a big factor in that?
You know it. Stress hormones like cortisol. Over time, clenching, grinding, especially during sleep. And folks with ADHD often have higher stress, so.
Makes those connections even clearer. So it's not just the act of brushing, it's the ADHD making stress harder, self-care harder,
Oh.
which then shows up in our mouths. Wild.
Wild, but thankfully not hopeless.
Okay, so we've uncovered this link between ADHD and oral health and how those executive function challenges can really throw a wrench in even the most basic routines. But before we spiral into a vortex of dental despair, let's talk about solutions. I always find that once you understand the why behind something, the how becomes a lot more manageable. And luckily, the research you shared is chock full of practical strategies for people with ADHD and their dentists.
Absolutely. There's so much we can do to bridge this gap and make oral health more attainable for everyone, regardless of their brain wiring.
Exactly. So let's dig into some of those strategies. One theme that really resonated with me was the idea of habit scaffolding, which I thought was a brilliant way of reframing the whole routine struggle.
It's a fantastic concept, isn't it? Instead of viewing routines as rigid, all-or-nothing endeavors, habit scaffolding encourages us to break them down into smaller, more manageable steps.
So instead of trying to overhaul your entire oral hygiene regimen overnight, you might start by simply committing to brushing your teeth for 1 minute every morning.
Exactly. And once that 1-minute habit becomes second nature, you can gradually build upon it. Maybe add flossing 1 day a week, then 2, and so on.
It's like building a staircase, one step at a time, until you reach that top tier of, dare I say, enjoying your oral hygiene routine. Okay, maybe enjoy is a stretch, but you get the idea.
I think enjoy is within reach, especially when we incorporate another strategy that came up a lot in the research, making it fun.
Oh, now we're talking my language.
Yeah.
Tell me more about this fun factor and how it plays into oral health, especially for folks with ADHD.
Well, we know that brains with ADHD thrive on novelty and stimulation, so why not use that to our advantage? Pairing brushing with something enjoyable can make it feel less like a chore and more like a natural part of a pleasurable routine.
Okay, give me some examples. What kind of activities are we talking about here?
Think about what gets your brain buzzing in a good way. Maybe you put on your favorite upbeat playlist while brushing or listen to a fascinating podcast episode.
I actually know someone who watches stand-up comedy routines while brushing. He says it's the only way he can make it through 2 whole minutes without getting distracted.
There you go. It's all about finding what works for you and makes the experience more engaging. And for kids, especially those who are sensitive to textures or tastes, letting them choose a fun toothbrush or a toothpaste flavor they love can make a world of difference.
Those little things can be game changers, right? And speaking of game changers, the research also highlighted the power of visual timers, especially for kids, but even for some adults too.
Absolutely. Visual timers provide that external concrete cue to stay on track, which can be incredibly valuable for anyone who struggles with time management or sustaining attention.
It's like having a built-in accountability buddy in your bathroom.
Right.
Plus, there's something so satisfying about watching that timer tick down and knowing you've conquered those 2 minutes.
Exactly. And for kids who thrive on visuals, you can even find toothbrushing charts or apps that turn it into a game or a reward system.
Love that. Okay, so we've talked about habit scaffolding, making it fun, using visual timers. Any other gems from the research we should add to our oral health toolkit?
Well, beyond those individual strategies, the research really emphasized the importance of finding a dentist who truly understands the unique needs of patients with ADHD.
Now, this is a big one, and I'm curious to hear more about what that looks like in practice. Because it's one thing to find a dentist who's technically skilled, but it's another thing entirely to find one who truly gets it when it comes to ADHD.
You're so right. It's about finding a dentist who understands that ADHD isn't just about being fidgety or easily distracted. It's about recognizing how those underlying executive function challenges can impact the entire dental experience, from booking an appointment to sitting through a cleaning.
So what distinguishes an ADHD-aware dentist from a typical dentist? What specific qualities or approaches should people be looking for?
Well, for starters, an ADHD-aware dentist will be patient, understanding, and non-judgmental. They'll recognize that building trust and rapport might take a little more time and effort, and they'll be willing to work at the patient's pace.
That makes sense. It's about creating a safe and supportive space, free of shame or judgment, where patients with ADHD can feel comfortable voicing their concerns and asking questions.
Precisely. They might also implement practical strategies to make the experience more sensory-friendly, things like dimming the lights, minimizing wait times, using noise-canceling headphones, or offering weighted blankets.
It's about recognizing that those sensory details, which might seem insignificant to some, can be make or break for someone with ADHD.
Absolutely. And beyond the physical environment, a truly ADHD-aware dentist will also be mindful of their communication style.
So we're talking clear explanations, concise instructions, and maybe even some visual aids to help patients understand what to expect during a procedure.
Exactly. They might also break down appointments into shorter, more manageable chunks, offer frequent breaks, and be flexible with scheduling to accommodate the unpredictable nature of ADHD.
It's about meeting patients where they are, both physically and emotionally, and recognizing that a one-size-fits-all approach to dentistry simply doesn't work.
I couldn't have said it better myself.
So, finding that ADHD-aware dentist can be a true game changer. But what about those day-to-day habits that play such a crucial role in our oral health?
That's a great segue, because beyond the dentist's chair, there are a few key lifestyle factors that can significantly impact oral health, especially for people with ADHD. And one that we can't ignore is the role of diet.
All right, so we've got these great strategies, finding the right dentist who gets it, that's huge. But then there's the everyday stuff too, right? Like what we're putting in our bodies.
Huge point. Diet affects everyone's oral health, but for folks with ADHD, those executive function quirks we talked about can make a tooth-friendly diet kind of tricky.
Okay, so break it down for me. Tooth-friendly diet. What's that even mean with ADHD in mind?
Well, the usual suspects are even worse for ADHD sometimes. Sugary drinks, for instance. Terrible for teeth generally, but if you're impulsive or you crave that quick energy...
Right, those temptations are strong.
Exactly. It's easy to see how those sugary drinks can derail even the best intentions, you know?
Like your brain's all, give me that soda, before you can even think, wait, my enamel.
Exactly. And then there's the refined carbs, white bread, processed snacks, basically sugar in disguise, fueling those cravings, leading to tooth decay.
So it's not just about skipping dessert, it's those sneaky sugars hiding everywhere. What about making good choices, though? Like telling someone with ADHD, just resist sugar is kind of pointless. No.
You're telling Ish.
Uh-uh.
The key is strategies that work with the ADHD brain, not against it. One thing that came up a lot was just having healthy stuff around, easy to grab.
So instead of chips and cookies, make sure there's fruit, veggies, nuts, that kind of thing.
You got it. Because when that craving hits and you're already in impulse mode, you need those good choices front and center. No extra effort required.
Otherwise, it's game over.
Pretty much. Oh, and meal prepping. That came up too.
Meal prepping, that's a good one.
Huge help, right? Especially on those days when you know time will be tight and you're more likely to make, well, not so great food decisions.
It's like setting your future self up for success, which I think we could all use a little more of, ADHD or not. Okay, so diet, check. Anything else lifestyle-wise that affects our pearly whites, especially with ADHD?
You know what surprised me? The exercise link.
Okay, I'll be honest, that one threw me for a loop at first. I mean, exercise is good for everything, sure, but our teeth, really?
It's fascinating. Research suggests that regular exercise can actually help regulate attention and reduce stress, which, guess what? Both good for your mouth, especially with ADHD in the mix.
Okay, so it's like a two-for-one deal. Exercise helps with the ADHD stuff. Andy makes for a brighter smile. Now listen,
Exactly. For one, exercise is a fantastic stress reliever. Helps lower those cortisol levels we talked about, which, remember, can lead to all that teeth grinding and clenching.
well, less stress, less jaw tension, happier teeth. Makes sense to me.
See? It all comes together. Plus, exercise releases endorphins, those feel-good chemicals that can boost your mood and improve focus. And when you're dealing with ADHD, impulsivity.
Oh, it's huge EE.
Right. So not just about preventing toothaches, but literally improving those executive function skills that help you make healthier choices all around.
I'm starting to think exercise is the answer to everything.
Well, it's a good start. And here's the kicker. Some studies even show that exercise can reduce those sugar cravings we were talking about before.
All right, you had me at exercise, but now you're telling me you can curb my sweet tooth too. Sign me up.
It's pretty amazing, right? Just goes to show how interconnected our minds and bodies really are.
For real. And we got to take care of the whole package.
Couldn't agree more.
Well, as we wrap up this deep dive, I'm feeling hopeful. Yeah, we uncovered some surprising stuff about ADHD and oral health, but also so many practical tips, things that can actually make a difference. And for me, the biggest takeaway is this. Knowledge is power. When you understand how ADHD impacts your mouth, you can advocate for yourself, find the right support, build a routine that works. So here's my final thought, and it's one I'm taking to heart myself. What's one small positive change you can make today to up your oral health game? Maybe it's calling that ADHD-aware dentist, trying a visual timer, swapping that soda for water. Whatever it is, take that step. Your smile and your whole self will thank you. Thanks for joining us on this deep dive, everyone. Until next time, keep exploring, keep learning, and keep those pearly whites shining bright. See you next time.